My best friend had 2 home births.
My sister had 4 home births. So we became very accustomed to the idea of home birthing.
Yeah, so when we got pregnant, it seemed soft and loving and sweet.
We talked to Kara, the midwife, about like, okay, so what happens if, you know, the home birth, something happens and we need to be transferred, like what happens? And she talked to us, she said, look, if something happens and we have enough time, there's a hospital in Montclair, New Jersey, that I'd like to take you to. They're really, really amenable to home births. It's a birthing center. That's the best case scenario.
Erin transferred into our care after a home birth attempt. Her midwife had called me the day before and said, you know, I have this patient, she wants to labor at home, I'm not sure that she is going to have a home birth.
And things were getting really, really difficult. I mean, you know, the contractions were really hard.
Things started to progress, but then in the morning they slowed down. They slowed down through the day.
Yeah, they just fizzled out. So that was hard because we had been through so much and I felt like we were just starting all over. I was just feeling miserable and knew I couldn't do it another 2 days. So when Grace and Kara got there, I was in the shower and I had just told them, I said, I want to go to the hospital. I'm done with this. I had always planned we'd have a natural birth, and getting here, I just really wanted an epidural,
Yeah.
which is something I never had planned for, but that quickly changed.
We had everything ready for having a birth at home, so it was really hard to let that dream go.
And ultimately, she had a cesarean section.
The typical cesarean that we are seeing today, and what I noticed, the drapes are so high, the mother cannot see anything, the baby is being born, the uterus is taken out to repair, and the baby is given out to the neonatologist or the pediatrician, and the mother doesn't get to see the baby until after 10 minutes, 15 minutes. Sometimes she doesn't get to see the baby at all until she goes to the postpartum floor.
The cesarean section rate has skyrocketed in the United States, and the women that have cesarean sections have a higher rate of postpartum depression and difficulty in establishing breastfeeding.
Dr. Haddad, at first he really explained how his C-sections are, how they're different, and what his philosophy is.
We have a new approach to cesarean section, and we call it the Gentle Cesarean.
I find that with the Gentle Cesarean section, when the woman feels good about her birth and feels good about what she's done, and she has a lower postpartum depression rate.
We use a special retractor called Alexis that make us see the baby coming out of the uterus just like natural birth. And more importantly, having the woman participate in the birth.
She pushed to get the baby out. Her husband cut the cord, and they had a beautiful birth, irrespective of the fact that she needed a cesarean section.
So we try to make the cesarean section as close as possible to the natural experience of birth.
Congratulations! How do you feel, Luke?
Is that mine?
She's so big!
Daddy?
That's your baby. That's your big baby.
This has really improved the outcome of the cesarean section tremendously.
I really don't see a lot of postpartum depression or difficulty breastfeeding when the baby is immediately put on the mother, with the skin-to-skin contact almost immediately, and where the woman is breastfeeding before she even gets off the table. You can do cesarean sections and honor the patient and still maintain dignity and control during this procedure. It was very clear they knew that this 11-pound, 12-ounce baby just wasn't coming out. And yet it came out with dignity. And and she felt good about herself and what she did, and they felt good about their creation. And that's what the important thing is.
You hear about vaginal births, being beautiful, and home births being so beautiful and such an amazing experience, but you never hear that about cesareans. But I mean, I'm gonna get emotional, but ours was beautiful. Okay.